Hello students, I am Dr. Mohammad Salim from Gaussian Medical College, Fatehpur. Today I am going to teach you obstetrics and gynecology subjects. In that I would like to teach you culdoscopy. You might have listened, you all students might have listened, and some of you might not have been listened. So whoever listen or whoever has not listened, so today I will explain about this terms culdoscopy, which is very important for the medical students. Basically, culdoscopy is the vaginal examination of female organs, female viscera or female organs by an instrument called as culdoscope. This is called as culdoscopy, and this procedure is performed by an instrument called culdoscope by inserting it through the pelvic cavity, inserting into the pelvic cavity through an area called as PVF, posterior vaginal formix. Now students, what is this posterior vaginal formix? Many of you might have been thinking about that. What is this PVF? What is this posterior vaginal formix? So I will explain you by the help of this diagram. This is the diagram of female genital organs. So you try to understand here. See, this is the female genital organs. In that, everything is explained by the diagrammatic representation. So in that you may notice that, see, this is the uterus. This part is called as uterus, okay, and this part is called as vagina. Now this is vagina and this part is uterus. This part is urinary bladder. This is pubic bone, and this urinary bladder opens through the urethra to the urethral orifice, and this vagina opens through the vaginal orifice. Now this uterus have its starting part. This is called as cervix. Now this vagina has two parts, anterior and this posterior, okay. So this posterior part and this anterior part, or you may call it as, this is distal end, this is proximal end, proximal and distal. So in this part you see there is in between the cervix of the uterus, this is cervix, this both two layers is called as cervix, okay, this opening of the uterus, and the vaginal end part, this corner and this corner is called as vaginal formix. So if it is anterior side, that is towards the abdomen, so this part is called anterior formix, and if it is lower position or the posterior part, that is back, where is the backbone, see this is the backbone of a female. So this backbone, if it is towards this backbone, so this will be posterior means near the this sigmoid colon or rectum. So towards the rectum is called as posterior, towards the bladder or upper part is called as anterior part. So anterior vaginal formix and this posterior vaginal formix. So An instrument is inserted through this posterior vaginal formix, PVF, posterior vaginal formix, this part which is end of the vagina. This is the starting of the opening of the vagina. This is in the part end of the vagina, and beside the cervix, and the posterior position is called as posterior vaginal formix. Through this place, the culdoscope or an endoscope for this vaginal examination called as culdoscope can be inserted from this place, enters into the pelvic cavity and study this uterus and other part, that is ovary or salpinges, which is not drawn here but it's there. Salpinges, that is fallopian tube, and ovary, which is not shown here but it is there. Okay, so can all the female viscera or female organs can be studied. So the things I told you, that the vaginal examination means examination through this vagina, inserting this culdoscope through this posterior vaginal formix, entering into the pelvic cavity and doing vaginal examination of this female organ, that is uterus, salpinges and ovary. Salpinges stands for fallopian tube, and ovary and other parts, that is adnexa and others. So this study is called as culdoscopy. Now the culdoscopy is this culdoscopy is done by inserting the culdoscope through this posterior vaginal wall into the pelvic cavity, through the pelvic cavity, through this posterior vaginal formix, in order to study. Now the next thing is to tell you that where this culdoscopy is indicated, how it can be indicated. So culdoscopy is only indicated if the female allows knee chest position. Knee chest position means the position where the female can up her knee, up her leg, that is knee, towards her breast, so that the vaginal part or vulva should be easily open and should be easily examinable. So we can examine through this very easily. And where it is contraindicated, so this culdoscopy is contraindicated in some disease or in condition that where the acute pelvic inflammation is there, so there it is contraindicated. And also it is contraindicated in vaginitis, salpingitis, and also cervicitis, and also in rupture of ectopic pregnancy, and simultaneously it is contraindicated in vaginal atresia. So that is all, friends. So I hope you might have understand this culdoscopy, and if any doubt you can ask in the comments. Thank you. Bye bye.